Hello and welcome to the Council Bluffs News. I'm Kyle Thomas. Hot summer weather paired with many outdoor activities could leave your skin exposed to skin cancer. Joining me today to teach us about prevention and the signs to look for is Jean Armstrong from Jennie Edmundson Hospital. She's the manager of the Family and Community Health Resources Center. Thank you for joining me today, Jean.
Thank you for having me.
First of all, the thing I want to know about is what should people do to prevent just proactive things that they can do to make sure that they're not going to be exposing themselves to dangerous UV rays and just stuff like that?
You know, cancer is 100% preventable, and every year in the United States, people are 2 million people in the United States are diagnosed with skin cancer. So all you really need to do is prevent the sun between the hours of 10 a.m. and 2 p.m. But if you do need to be out in the sun, make sure you're wearing a sunscreen, wear a hat, and light-colored clothes.
Is there a certain sort of sunscreen, I mean SPF, what's the best one that people should use?
Really, the stronger the better of the SPF in the skin screens.
Okay. As far as skin cancer goes, what are some signs that you might have something, you know, something that people should look for if they're worried about, if they have something on their arms or leg or something like that, that they should probably go get checked out? What should people be looking for?
Well, definitely an obvious change in your skin, but then also an obvious change in a mole. That's a sign of melanoma. And I did bring a poster here today to show you what normal melanoma looks like. This is a regular mole, so it would be a brown spot. Okay. Different types of warning signs of melanoma is what we're looking at with the mole. So warning signs of melanoma is you need to follow the A, B, C, Ds. A is for asymmetry, where one half of the mole is different than the other half. That's a definite sign that needs to be checked out by a physician. B is for irregular edges. So as you see, this is all irregular. That would be another thing that needed to be checked out by a dermatologist or a physician. C is for color or pigmentation, where this side is light and this side is dark. And then D is for diameter greater than 6 millimeters. So that would be greater than the tip of a pencil or a pencil eraser. These both would be signs that would need to be checked out by a physician. And those would be warning signs of melanoma.
Okay. Jennie Edmundson is going to have a cancer screening on June 29th. What do people need to do to get registered for that and to be able to go in and get checked out for themselves?
Correct. Jennie Edmundson is having its 15th annual skin cancer screening on Wednesday, June 29th. It's from 5 to 7 p.m. at the hospital. It's in the outpatient surgery waiting area. Pre-registration is required, so you need to call 712-396-7600 and pre-register for that event. You could go in with just a suspicious piece of skin that you want the doctor to look at, or the doctor could do a total head-to-toe body check. So it's up to the patient. And then the information will be mailed out to the patient and their physicians in case they need some type of follow-up. It's a free cancer screening and it's open to the public.
Okay, well that is fantastic. I want to thank you again for coming in, Jean. It's been very educational for everybody. I just want everybody to remember that again, the skin cancer screening is at Jennie Edmundson Hospital, Wednesday, June 29th from 5 p.m. to 7 p.m. There's limited space for this skin cancer screening, so register today. You can do that by calling 712-396-7600. Council Bluffs News will be right back after this.